What are possible indicators of domestic violence in the mouth and dental area? This is Sebastian. He experienced physical and psychological violence in his relationship for a long time. Back then, his dentist was the first who spoke to him about domestic violence. Even though Sebastian managed to escape the violence only years later, the conversation with his dentist was a door opener. But what are indicators of physical violence that can be recognized in the oral area by dentists? The affected areas are categorized into injuries of bones, soft tissues, and teeth. Let's start with injuries of the bones. Fractures can occur, for example, of the jaw, cheekbone, or the nose. Dislocations and injuries to the jaw joint can also result from violence. When taking X-rays, for instance, one should be attentive as previous traumas may be evident. The area that dentists look at most often are the teeth. The maxillary incisors are most commonly affected by traumatic injuries. For example, gaps, fractures, or dislocations may occur. Another indication that should raise increased attention is a generally poor dental status. Victims are often isolated from the outside world and may neglect dental appointments, leading to a potentially poor dental status. Psychosocial factors, such as increased stress due to violence, can lead to an elevated risk of periodontitis even at a young age. But sexualized violence can also be recognized in the mouth. For example, prolonged semen exposure in the mouth can lead to enamel erosion. Bulimia, which is defined by recurring episodes of eating extremely large amounts of food in a short time, and compensatory measures such as self-induced vomiting, also leads to enamel erosion. Bulimia can be triggered by sexual violence too. Now, let's address injuries of the soft tissues. Possible consequences of physical violence include a torn upper lip frenulum, petechial hemorrhages in the oral mucosa, and various inflammatory reactions. Sexual abuse can leave traces in the oral mucosa, such as abrasions of the palate and sexually transmitted diseases. Coming back to Sebastian's story, it becomes clear how crucial it is to be aware of the signs of domestic violence that can potentially manifest in the mouth and dental area. Only because his dentist was so attentive and trained to recognize all indicators, he could talk to his patient about this sensitive issue. Dentists are in a unique position to recognize domestic violence. Further information on domestic violence can be found on the European Training Platform.